4th of July is a great time for families to be together. Kids are off from school, many parents have days off on the weekend, family and friends are all spending time together at their home or on the pool. Because of the great times that can happen, a lot of people may be distracted by all the activities that are going on. So it's important for families and parents to take an extra moment to remember to be safe so that the children are always supervised and they don't have any injuries, ruining an otherwise great weekend. The National Fire Prevention Association reported in 2011 almost 10,000 people were injured from fireworks every year. The majority of those were in young people aged 5 to 19, so this is clearly a pediatric issue. While I don't have any specific numbers for how many Texas Children's Hospital sees, it's clear that this is a significant contributor of injury in children during this holiday weekend. No firework is ever truly safe. A lot of the fireworks, for example the common sparklers, can reach temperatures over 1,000 degrees, which can certainly melt metal. If a firework can melt metal, you can imagine what that would do to a young child's hand, face, or eye. I think the safest way for families and children to enjoy fireworks would be to attend any one of the myriad of firework festivals that are going on this weekend and next. It's very easy to look in the paper, to go online, and to just do a search for outdoor firework festivals. Most of them are free. It's a great time to enjoy a great evening with the family and watch some awesome firework displays. The first thing a parent should do if they notice their child's been injured by a firework is to make sure that the child is removed from the fireworks. So getting them to a safe distance, removing the sparkler from their hand, things such as that, just to make sure there's no further injury. The next thing you do is to try to gauge how severe the burn may be. There's 3 types of burns that we typically classify them into when we're looking at a patient. The first type would be a superficial burn. This is a type of burn where the skin's very red, but it's intact. It most commonly looks like a sunburn that we would see during this time of the year. This type of injury can be treated quickly by the family with some Tylenol, acetaminophen, or Motrin ibuprofen, accompanied by a small amount of a topical antibiotic. The next degree of thickness injury would be something we call a partial thickness injury. These types of burns are more severe. They're accompanied by blistering on the skin, usually with a significant amount of pain. I would advise parents to, same thing, make sure the child is not subjected to further injury, and when they see the blisters, to take their child to the nearest pediatric emergency center for assessment. The most severe type of burn that we see is what we call full thickness burns. These are types of burns which usually result from prolonged contact with heat or thermal injuries. And these types of burns, interestingly, they burn through the entire skin, but a lot of times children don't seem to be in severe pain. That's because the burn is proceeded not only past the skin, but past the nerves and into the muscles as well. Those types of injuries should definitely be seen by a pediatric emergency medicine specialist. Many parents and families, all they want to do is the right thing for their child. And as a result, there's a lot of home remedies that exist, certainly with the intent of trying to relieve pain. What we'd ask is that if a child does have a burn, that a family try to withhold putting many of the home remedies, such as butter, mustard, mayonnaise, any type of food product. The best thing to do is, again, to remove the child from the source of the injury, giving them Tylenol or Advil for pain, and if they have any concerns about the degree of injuries, to seek medical care. It's important for parents and families to know where the closest pediatric hospital is, simply because children's hospitals are more focused on the needs of children. The physicians and nurses are staffed with providers who only specialize in children, who can tailor the care to the developmental appropriateness for that particular patient. A lot of times there's other support staff such as child life, respiratory therapists, whose sole mission and sole practice is focused on the special needs of children. In the greater Houston area, Texas Children's has 2 pediatric hospitals. Texas Children's West Campus, which is located at Barker Cypress and I-10, and then Texas Children's Hospital Main Campus, located in the Medical Center on Fannin. It's important for families to know which facility they may be closer to so that their child can receive the care most expeditiously. Over the 4th of July holiday weekend, since families and friends are together, children out of school, there's going to be a lot more visits to pediatric hospitals. Therefore, it's very important for families, grandparents, and other providers to make sure they have ready access to the child's medical records and the most up-to-date information so they can give this to the provider so that they can give the best care to the children. I think 4th of July is a great time for families, friends, everyone to get together and have a great time. The one thing I would ask is that when you're together celebrating, watching the fireworks at the displays, having a great time, is just be sure to take one extra minute just to make sure where are your children, what are they doing, who's responsible for supervising them, and make sure that the kids have plenty of safe, fun activities to keep them occupied.